Hello, Susanna. It's nice to be here. Can you please explain us a little bit where we are? What is this place?
Yes, welcome Andres to our School of Healthcare and Social Work here at St. Aoc University of Applied Sciences. Right now we are here in one of the simulation rooms. Students simulate here before going to practical training. I think this is the intensive care simulation room or emergency care room. They practice here how to resuscitate patients, and we have here two so-called patients on which students can practice together with the teacher.
Who studies here? Like, who are the students who actually come to this room and try to resuscitate and learn about care for patients?
Well, definitely future registered nurses and future public health nurses come to this classroom. We have many other degree programs here, but they don't come to this classroom.
Okay, so we are here today to talk about the nursing program. And can you tell us a little bit about the program in general? What it's all about?
Well, the degree program in nursing is based on both general and specific competencies. A registered nurse graduating from St. Aoc University of Applied Sciences will have the knowledge based on evidence, the skills, and the professional attitude to work as an expert of nursing.
And this nursing program, how long does it last?
It is 210 credits, and it lasts 3 years and a half. And it is carried out both in English and in Finnish. And we encourage students to work on their Finnish language skills. And if they do well, if they learn Finnish well, they can finish the program in 3 years even.
Okay, so for example, we're talking about a nursing degree program in English, but then the students should learn Finnish. And what is the reason for this?
Because of practical training. We provide practical training places because the degree, which is 210 credits, as I have said, out of these 210 credits, 75 credits are practical training. So that's a lot of practical training, and this is all done in Finland with Finnish patients. Of course, there might be international patients, but mostly in Finland we do speak Finnish, and they need to learn Finnish as well, and we definitely encourage them to do that.
And I think that is great that the students are able to do these practical trainings, because then when they actually go to work life, they know what it's like to be already working, like they have earned this work experience at the same time while they study. I think that's great.
Yes.
Could you tell us a little bit about some of the study modules that the students go through or will learn, while they're studying here at SAMC?
Of course. As I have said, there are both general studies common to all students at SAMC, such as languages, computer skills, research methods, what else? Entrepreneurship. And then, of course, there are nursing-specific courses, such as surgical skills. I have the curriculum right here. For example, medication and fluid care, gerontological nursing, basics of clinical nursing, skills labs, and so on, perioperative nursing. There are many, many professional courses.
That's great. And you mentioned some other courses that are not so-called related to nursing at first, like computer skills or ICT and all these. Why would those courses be important for the nurse?
Well, digital skills are important for everyone nowadays, and everything. This is a digital campus, so we must be able to use digital tools wisely and ethically. And of course, we talk about the artificial intelligence nowadays, and also we practice how to use language academically in writing and in orally as well. So it is important for all our students to have the general knowledge of academic studies and academic world.
Thank you, Susanna, for this. I'm very ignorant in when it comes to as not being connected with health and care departments. But for example, I believe that I know the places where students can work. But once again, out of ignorance, I would just say one or two places. But can you tell us, on your experience, in what kind of places can the students work after graduation?
Yes, there are many environments when students can be employed after graduation and also before graduation. Our students, when they graduate, they work as experts of nursing, and they can work, for example, in primary healthcare, like in the public sector, primary healthcare, or healthcare centers, home care, in hospital wards, in emergency centers, pretty much everywhere, in elderly homes, then of course in the private sector also, and in the third sector with different organizations.
Okay. What makes this program so special that St. Aoki University of Applied Sciences decided to have one of these same programs in English?
Of course, Finland becomes more and more international. I think nowadays there are a lot of foreigners living in Finland or wanting to move in Finland, and definitely many Finns want to work abroad, outside Finland. And there was a great demand for this program, and now it's very popular. For example, this year we have a very big group, over 50 students decided to study with SEAMK. So I think there are many reasons behind it. Going abroad to work, and also being able to work here with international clients.
Yeah.
This could be the most important reasons.
And for example, you mentioned the word international. Like, what kind of international experience can the students expect here at SEAMK?
We have a lot of activities for international students, and we try to integrate international students as well as we can, and to have them interact with Finnish students. There is exchange opportunities. There is, in the third year of their studies, we call it the international window, and students can go for an entire semester abroad. We have a lot of partners here at SEAMK all over the world, so that the students can just name the location and we pretty much make it happen for them.
Yeah, and for example, here at SEAMK, it's also well known that there is many international degree programs where we have the students from different places coming and studying here. And I believe they also have the opportunity to kind of widen their network.
Yes.
Yeah, like by getting to know people from different fields also who's studying in English.
Yes.
And that's very nice.
As you know, networking is essential to any profession nowadays, but as a nurse, you never work alone. You are part of a team, and you cooperate with a lot of different kinds of people. So that's really important, and we try to teach our students in school how to connect well and to set networks that will help them in their personal and professional life later on.
St. Aoki University of Applied Sciences is obviously located in St. Aoki, but I would like to ask you, how is St. Aoki? Is it an open area for foreigners to work, or how do you see this?
I would say yes, especially for our nursing students. There are very good job opportunities, and they have many opportunities to, find different activities close to their heart for their free time, but also professionally. Most of our students, if not all, I would say 99%, are provided a job after their first practical training. So the first practical training is in the first year of their studies in spring. And almost all the students are offered a summer job after the first practical training, because we teach them Finnish language skills and of course nursing skills, and we tell them to try to make a good impression. And international students are very motivated because they have to pay for their studies and they want to be part of the group and integrate and learn the language. So they make a good impression. And for example, last year's group, all of the students received a job after the first practical training.
Nice.
And then the second practical training might take them to the next level and get a better job in nursing. All this in nursing. So for nursing students, the situation is very good.
And regarding the practical training, are the students responsible to find their own practical training? And I'm asking this because if a student comes from abroad and their Finnish skills are very limited, it might be difficult to actually find the right place and the right people.
Definitely. Well, here in our school, in our degree program in nursing, we provide practical training place for each student, one place. And it's in this area of southern Ostrobothnia. So if the student is not happy with that place, they are free to look for a place themselves. On Jobili, we have this program all over Finland. It is called Jobili, and it is open for all the students in Finland, all the students of healthcare, and they are free to book a place on Jobili anywhere in Finland.
Wow, that's great.
If students live elsewhere, say in Helsinki area or Rovaniemi or in other parts of Finland, they are still able to do the practical training close to home, because it's always, if school is only 2 days a week here in campus, practical training is every day, and even on weekends. It depends on the place and what kind of working hours they have, but it's in general at least 5 weeks, consecutive weeks. So it's definitely easier to be closer to home if they are not living in Seinäjoki area.
And once again, how many practical trainings do they do through the whole degree program?
So, as I have said, 75 credits in total, and in the first year it's just one practical training, because there is a lot of theoretical training before that to prepare them for the real training place. And in the first year it's just 5 weeks. But then in the second year there are, I believe, 18 weeks. There are 3 different practical trainings. There's a gerontological training. I don't remember exactly which trainings are in the second year, but in total I believe 18 weeks. And in the third year it's more and more training and less and less theory. And in the last part of their studies, it's the deepening of the nursing expertise. So the last semester is only practical training, where students can specialize in a specific area of nursing, like perioperative nursing, pediatric nursing, mental health nursing, emergency nursing, gerontological nursing.
Is this a specialization on their choice, or is
Yes.
what is available?
Yes. So we have several options, like 5 or 6, and students can choose from that.
That's
Of
great.
course, they can get back to this after they graduate if they find an interesting working place and they haven't thought about this specialization, because as you know, the healthcare is so broad. You can work with everybody, from children to elderly people. So there are so many places they can work
They
and
have a lot of
specialize in.
advantages. Yeah.
Yes.
And lastly, why should an applicant choose SEAMK as a study place?
Well, of course, SEAMK used to be, and we still are, among the best in Finland. It's a very good university, and degree program in nursing has always had very good feedback from students. We take very good care of students. All of the students from SEAMK are very well received, I think, from what they have told us, and we try to take good care of them, because every teacher is responsible for the students' well-being, overall well-being, and not only the academic achievement. And we have many study counselors, many tutor teachers. We have a well-being team with school pastor and school psychologist and special education teachers, social workers, and then of course we can refer students to the relevant parties if they need any kind of help. We help students a lot with different aspects of their both academic and personal life.
And I think that's great because that gives us then the title of one of the best universities in Finland. And
yes,
that's great.
Yes, and we try to help students stay on track, like follow their curriculum, come to school. We react immediately if we see in our system that some course was not completed, even if it should have been completed last week. We immediately contact the students and talk to them and try to find solutions.
Wow,
So-
that's great.
Yes.
Well, Susanna, I want to thank you for answering all these questions regarding the nursing program. I think it's important for our viewers to see, that yeah, we are a great option for your future, and we hope to see you all here.
Yes, we are welcoming you to SEAMK, School of Healthcare and Social Work, to study to become a nurse, international degree program, so that you can work both in Finland and anywhere in the world. Welcome, and we are looking forward to meeting you here.